Welcome to the Vital DocTalk show. And on today's episode, we have Denicea Hilton. Welcome to the show.
Hey, welcome to me and everybody else that's listening in. Thank you so much for having me.
Awesome. I'm so glad you're on. So first of all, let's jump into your background. So, fill us in on all that. How did you get to where you are today? What motivated your journey to, join the healthcare space? And what's your vision for the future?
Yes. So my background is in acupuncture and Oriental medicine. So I'm a practicing doctor of Oriental medicine here in Florida. I originally, when I started out, like post grad, and actually now I think about it, during internship and everything, I was focusing in on women's health. And so when I left and started my practice, I focused on menstrual health and fertility health predominantly. While practicing there in that space, I got a chance to see that there were some other things going on. Being in Eastern medicine, there's a holistic approach and perspective. And so I really got to see just how much it is that the way that we think, the way that we might feel, what are our lifestyle choices, where did those choices even come from? Like, what is causing you to make that choice, and how it all actually plays a role. Because then ultimately what I'm seeing physically is actually more of a manifestation of all of those other things. And so I found myself growing in that, understanding the being, understanding the person, understanding their spirit, and how is it that you can truly help and guide someone to align in spirit, mind, and body. um, Medicine has always been an interest of mine. Like, ever since I was younger. We I mean, unfortunately, we were in and out of the hospital a lot, with family health issues. um, and one thing that I can say, though, that I used to get in trouble for was always asking questions of the doctors that were in there. And they would always, and it was quite interesting because it's like, you don't question the doctor, but it's like, no, I actually really want to understand, like, where are you coming from? So that, I've always had that interest. The interest in medicine changed when someone introduced me to Eastern medicine, and really why I chose to go that route was because I found it to be more empowering to the patient, more empowering in that we're helping to build up the space for them to be able to foster the healing for themselves. And so really I'm a conduit, and really just reading and interpreting everything that's involved in that process, but to allow them and give them that cushion and that support for them to do it is just amazing.
Okay, that's great. And it did hit me that you're a bit more holistic than, like we've had like plastic surgeons on the show or chiropractors, et cetera, that specialize in just one thing. You strike to me as the type of person who's more holistic. So you look at the big picture, and that's awesome. And how long have you been around for your practice? How long have you been on this journey, and where do you see yourself going?
So I have been in practice for 5 years on my own. Adding a couple years on top of that when it was under supervision in our clinic,
Mhm.
um, which I do count those because that's where we all had to start somewhere with
Mhm.
someone that trusted us in their journey. Um, right now, you were saying, like, where do I see myself?
The future, yeah. Like, what's your vision for yourself for the future?
Yeah, for myself, I really see, and it's happening now because of the blessings of COVID. Um, and that I really want to continue in creating this space and being innovative as far as what does this space look like outside of a traditional clinic or office,
Mhm.
of helping someone to see how it is that they can create that environment for themselves to heal, and to really understand, like, it's a journey, it's not a destination. So in whatever ways it is that I can help really shift that thinking and shift the whole paradigm when it comes to what actually is involved in healing, then that's my thing. So do I see myself still seeing patients? Yes, but in a different way. And then also expanding it into, going out and speaking more, whether it's on more shows like this, or whether it's, going into talks, speaking on panels, to really be in those spaces that people can see, because health is everywhere. it's everywhere. It's not just in the healthcare
Mhm.
industry. It just because you're in tech, just because you're in marketing, just because of whatever, you still have your own health that you're concerned with. So it's really everywhere. And then, like I already discussed, all of that even plays a role into your own health. So where, like, I just see myself continuing to have a whole bunch of conversations in all these different spaces that seem like they're completely unrelated, but they actually are related, because like we are a physical manifestation of our environment. So
That,
then
I mean, that
how
makes a lot of sense. And to focus it also on the marketing element, I think, you might make a channel on TikTok or Instagram or Facebook and or websites and podcasts and all this, but it is all health related because you can always bring it back to that point. So that's
yeah.
that's awesome that you're looking to diversify. And so looking at your experience over these 5 years, what's been your favorite way to grow your practice? And how's that been going?
I will say that word of mouth has been one of the big ones. And then a patient introduced me to podcasting. So
Mhm.
where originally I had my own podcast, I've really more so realized that the bigger percentage is actually guesting on other podcasts. And so like those would be, I know you said one, word of mouth definitely got me, like helped me get started. And
Mhm.
it's still like people still talk and everything else. I just feel like the podcasting, like guesting and stuff like that actually helps, because you at least meet someone that it's then by their word of mouth of what it is that you can do, that you can still build.
I like that because you could also like this content right here. You could use it for whatever you want to do or give it to your audience, etc. So that's the awesome part about being a guest. So why don't we dive into that first briefly before we go into word of mouth, which is obviously one of the most powerful ways. Do you have any methodologies? Help a reporter out. Any websites you go on to get more exposure, or how do you become a guest?
So help a reporter out. I go through that one on spurts because it
Nice.
can get overwhelming with all the
Mhm.
emails in one day. The my favorites actually are on Facebook, and being a part of those groups where there's other podcasters, and so some of them are posting because they're trying to find guests for their shows. Another one would be Podcast Movement. They just started their Mighty Networks, so they have their own thing there, and there's a group within that, just people looking for guests, or you want to be a guest and you can pitch yourself. My favorite other group on Facebook is She Podcasts. So every week there's that pitch. There's also some apps like Podcara, I think just started. So experimenting with them. I understand that there are agencies out there, and I have not gone that route just yet. And I
Mhm.
think I've had experiences from me hosting my own podcast where an agent clearly did not understand my podcast. Like they didn't listen to it, or they didn't know my background. So the pitches were just really off. So it kind of soured me a bit as far as, do I want to actually involve an agent for myself? So if that's any information for anyone who's looking out there, please, please, please partner with an agency that actually gets what it is that you do, and they take the time to research the shows that they're pitching to. Because yeah, like pitching to somebody that you're not taking guests, it's your reputation, not the agent's reputation, that gets muddled. So that's one thing that I would offer there. Another might be, what is the name, oh my gosh, Steve Olsher actually
Hmm.
has a summit that is done twice a year. I'm not quite sure what his plans are right now, due
Mhm.
to physical distancing issues, but he has a summit where you're going up and you're just literally pitching yourself to people that have mega powerhouse type podcasts. And so right then and there they let you know, like, yes, I would love to book you, or here's a tweak to your pitch that they can offer for a future, or even for others. So that might be something else that somebody who's just like, I just want to go and get it done and don't have to do much follow up, like that's a spot that I would say would be one of the perfect spots to do that.
That sounds great. So you guys check out, I guess, Steve Olsher and
Yes.
Podterra. And I think also you made a great point on, agencies like when people would team up with us, we do this for link building mainly because we just do Google traffic SEO. But you guys do this yourselves. Like you just, make a list of 50 different podcasts. You just got to do a lot of Googling and then you just pitch them your script or whatever.
Oh
And,
yeah.
the network is, I think, is another one, right? You can go through other doctors and type in like your fellow doctors and then plus on Google, then you do plus podcast, and then you could see guest podcasts they've been on. So that could
I
be
like
great
that.
introductions. Awesome. And then let's go to word of mouth, which is, the number one proven golden way to get clients. Do you have like a methodology to get word of mouth? Do you have like a client satisfaction process?
Not really.
I'm sure you have
I
something, right? I know it comes across that you're very authentic, right? So maybe
yeah.
that's just something you have naturally, but I want to diagnose this for the audience for sure.
Yeah, like I think you're spot on. Like that's just it. Like the from what I've gotten, if somebody was to reach out to me that I didn't know and they'll let me know, hey, so and so told me about you. Um I mean, it comes out. They're like, that's just what I found out is that you're just really nice and you just listen and you understand more. So if that is a methodology, it's just me being who I am, then that's it. I understand that there are processes you can ask for it more. So I have
Yes.
started in some ways, and you know what it is? Because coming from, like I said, the menstrual and fertility being the predominating specialty, right? Those are very, very intimate. Like I understand that there's other specialties that definitely there's some people just don't want to tell people about it, right? Like
Mhm.
that they're even getting help for it. So like these are two examples of that. So while there's two examples of that, it's like, are they really willing to even give you a testimonial quote that you can use, right? And because they may not even want their name out there. They may not even want
Yes.
their face out there. So like it's all of that. Or like fertility, that can be months, sometimes longer than a year. And then like, I had one tell me once that she was hesitant on even filling it out because she wanted to make sure she went full term and actually had a baby, or she wanted the
Of course.
confirmation from an ultrasound. Like, so it's that part that I feel like I end up having to very gently and mindfully navigate that.
Yeah.
If they really feel like I helped and I was of service, what'll happen is they're talking in their groups. So I can't rely like on a post on Facebook or a post on LinkedIn. I can't rely on that because that means that they would be in that spot that they'd be willing to put it out there, and they may not.
Mhm.
So it all is like I have to trust in the background work that's
Yeah,
happening.
psychologists have that same, and psychiatrists, they have that same issue where they can't really ask for referrals too much anyways, or even respond to criticisms online, right? So that's
Yeah.
probably, in fertility, I can understand how that's a problem. Maybe you could tell them, hey, if, you get pregnant, you have to name the baby after me in my clinic. But yeah, but it makes a lot of sense. Dr. Kate Kelly, she's a chiropractor, and word of mouth is her favorite. But whenever she gets a compliment, she asks for referrals. I think somebody like you, right? You'd probably have to go more down the route of, well, what can I do to improve, right? I really appreciate this. What can I do to improve? And the second they say, oh, well, you can't do anything better, that's when you're like, well, look, I'm really trying to get referrals. That's the way our practice is growing. And kind of, you got to do it like
Yeah,
uh,
that makes sense.
yeah, you got to do like a secondary source because yeah. So some of you doctors out there listening, yeah, if you're like a psychologist, psychiatrist, right, where you don't want patients don't want to be known, then you got to do it that way, and they'll probably give you great ideas and feedback, etc. So that's
I
awesome. I
love it.
like that. I like that word of mouth model, and that is the best. So moving on to COVID, right? And I think if you've been around for 5 years, you're going to start getting referrals, especially if you're authentic, you do great work, etc. Right? I like to emphasize systems and processes myself because that's the way you scale faster.
Mm.
But moving on to COVID, right, today, um, how's that impacted you? How do you, tell other doctors to bounce back? I know a lot of people have been impacted hard, so, we'd love some words of wisdom there.
Yeah. Well, I have a few things of what I've experienced. I mean, in our state, We were definitely considered non-essential, so they were closed, or we had to close our offices,
Mhm.
um, which was really, really interesting to navigate because, as we talked about, like this model being very mindful of the mental emotional aspects of one's healing, and then to just something like this, like COVID happening, incited a lot of fear and panic and anxiety. And like one really cool modality that can help with that was just told it no, so like it was very, yeah, very interesting. So closed. However, I then started thinking, like, I had some ideas, like I said, as far as where it is that I want to generally go. And I just think that during this time period, it allowed it to actually expedite. So it might have taken me longer, but now, like, wow, within these like 2 months, I've put together completely different experiences that can be offered online and in different ways, whether it's there's a membership that's there now, there's a group mentorship that I plan on actually starting next month, and then also doing these like day retreats that were originally supposed to be in person 2 weeks prior to that first in person one was the shutdowns, and so converting that to being done online. So glad I had experience with Zoom. And so already,
That's
because I
great.
understand many of people didn't have
Did not know. Yeah.
yeah. So like just during that time, it's just having to sit back and like, if that's what I can implore upon anybody else that's listening, is sitting and really looking at what it is that you know, and then how it is that you can take that and understand, because there is an element of, just because you can't physically see someone. So just because I may not physically adjust someone, right, or I may not physically be able to see them person to person, but like really get creative and really understand and own what you do. Like you don't necessarily have to adjust someone to make an impact in their health. So like get creative in that. I know other chiropractors started getting into nutrition and getting into other lifestyle recommendations. You can still do that via telehealth. So, like, kind of really pulling that out of yourself. And sometimes it might take someone else to do it for you, to pull it out of you, because we can be so like ingrained in it that we might need someone to pull it out. And then that way you can see it in front of you. And then how is it that you can repackage it?
I mean, that's a fantastic point. Like let's say you're a chiropractor or acupuncture, it doesn't matter, right? Like the bottom line is your patients see you because you're solving a problem for them, right? So if you focus not on, hey, I'm a treatment provider, but I'm this problem solver on problem X, then you got to ask yourself, okay, for example, your chiropractor, I help people with spine issues. Now they can't see me. What would I recommend they do, right? What should they do at home? And now you can digitize that, right? You can think about how do I turn that into an info product or a Zoom
Yeah.
session or whatever, right?
Like,
And then,
speaking of Zoom, how about if they did put out something saying, "Oh, you're on a lot of Zoom calls now. Let me tell you how to sit properly. Make sure,
mhm.
like, you totally go into ergonomics. You can end up setting up an Amazon affiliate all of a sudden, and now you got this blog post with your top recommendations. So there's other ways that you can bring in revenue that's outside of someone coming in to get that adjustment, but you're still offering that."
Exactly. I think that's fantastic. As long as you're trying to solve that problem that people would see you, then that's you've still got the same audience, and it's a perfect time to get on that info side, the book, whatever. So, closing it out, Denicea, what is one tip or trick you think doctors should consider to take their practice to the next level that you often tell them?
You got to have conversations with people outside of your industry and outside of your modality.
Mm-hmm.
And because when you do that, it's understanding then we're all seeing the same people, but we're seeing the same people from a different perspective. And so, if now this is the assumption, all of us went into whatever form of medicine to help people to feel better, right? So, that's the
Mm-hmm.
assumption there. So then that means then that just by having conversations with other practitioners of various modalities, all you're doing is actually creating this hugely supportive bubble for that same person, where they feel like, wow, my practitioners are not competing against one another. They're actually learning from one another for my benefit. And then that is what will help them stay to course treatments plans, even increasing in communication. Because I'm going to tell you, I got people that they will not tell their other physicians about what we're doing, all because they didn't feel like they could trust them. And they felt like whenever they've done it before, they were belittled or pretty much told them like, no, that doesn't work. So then like that whole trust in the relationship between the patient and practitioner can be really shaky. And if it is shaky, then you as a practitioner actually are not even getting all the information that you need for you to better be able to do your job. So
That's awesome.
by creating that bubble of each, just even if it's once a month, right, or twice a month, if it's you that makes that initiation to just meet someone, if it's locally or on in a Facebook group or LinkedIn group or whatever it is, intentionally reach out to someone that's outside of your modality and outside of your specialty, just to get to know what it is they're doing. Because telling you, more and more patients are going to start seeing, more so than ever, people as practitioners in their own support system. So the more that we can start to gather together, then we can really hold that space for them in a healthier way.
I mean, that's a great point, right? I think that if you've got a really strong network in your space that you're trying to be a part of, which is, for chiropractors, whatever, like if you know all the other members, then you could share information. You can make sure you truly help heal your patients and, all the touch points, and you're always in the loop. And last but not least, also, I always like to think that, people can either completely solve your problem or make it much easier to solve. So if you
Yeah.
go and you actually build that network, your practice will just fall farther ahead, not just in how you treat your patients, but also the level that other doctors will help you take your practice. So that's a great tip. And where can people find you? What should they be checking out? Let us know.
So you can check out my website, consider that my home, at
Mhm.
DeniceaHilton.com. That's DENICEA, then Hilton.com. Other than the website, then it would be between LinkedIn and Facebook is usually, or Alpha, that I'll be hanging out on.
Awesome. Well, thank you guys. And that was another episode of Vital Doc Talk.